Today I'm going over the top 10 treatments that I know of for Charcot Marie Tooth disease based on all the new studies, and we're starting now. While there is no known cure currently for Charcot Marie Tooth disease, studies have gotten a lot better. And in fact, survival rate and livability with this has improved dramatically. The lifespan is not significantly changed, but if certain people don't do the right things, they can become disabled, they can have a lot of pain, and we want to do everything possible to help manage those symptoms, maintain mobility, and improve your quality of life. First, here's the top 10 symptoms of Charcot Marie Tooth disease and things that people see. Now with Charcot Marie Tooth, I'm not going to go over things like gene therapies, stem cell injections. Even though these things are phenomenal, they're not quite there yet. So unless something comes out after this video, and it might speak to the age of this video, new studies right now do not show that stem cells are particularly effective, even though that's coming. There's also neuroprotective drugs, so peripheral neuropathy type drugs. There's a lot of great medications that can help treat nerve pain, but not to specifically reverse or cure peripheral neuropathy pain from Charcot Marie Tooth. I do have a lot of videos on that type of nerve pain and the best supplements, the best diets, the best treatments, but that's not specific to Charcot Marie Tooth. If you want those, check that down below. And there are some great options. These things actually do work fairly well for a lot of people. And also genetic testing. Genetic testing is getting much more affordable. If you're not sure if you have it or not, genetic testing is available. You can get it through your neurologist, or now there's becoming cash pay tests available where you can even screen for a lot of these genetic diseases. What we're going over today is treatments that I do in the office that can be extremely effective for Charcot Marie Tooth. The first one we're going to start off with is physical therapy and strength training. This is so huge, potentially the most important thing that you can do. When I say physical therapy, I see patients sometimes roll their eyes. They're like, hey, I already did that, it's not working. What I'm talking about is strengthening your thigh muscles, your hamstrings, your calf muscles as much as possible. Certain muscles in Charcot Marie Tooth are going to get weaker. Around your hands, around your feet. You want strong thighs, strong hamstrings, strong core as much as possible. This will help prevent muscle weakening and encourage more activity, more walking. So patients that do range of motion exercises, stretching, strengthening, and exercises, this has been shown to dramatically make a big difference. I know we love to talk about medications and supplements, and to have that immediate solution is very tempting, but statistically, strength training and physical therapy is the single number one thing you can do for your Charcot Marie Tooth. It's just not as exciting because it is a long-term solution. Number two, occupational therapy. So this is something covered by insurance. An occupational therapist can actually come out to your house and it can adapt with your hand function, with your foot function. Do you need potentially bars around your entrance? Do you need a ramp? Do you need shower bars? They can evaluate your house and they can go over adaptive tools and techniques to simplify tasks at home and work. This can enhance your independence, especially as you get later in life. It already sucks getting old. Getting older with Charcot Marie Tooth is even more painful. And I'll tell you from my experience, patients who do a lot of this earlier stuff, like physical therapy and occupational therapy, build up a lot less pain and a lot less nerve pain over time. Number three, orthotic devices and ankle devices. This is huge. So with Charcot Marie Tooth, you're gonna get a high arched foot, and that rubs on top of your foot and rubs on the bottom. That can cause plantar fascia pain, it can cause ankle pain, it can cause Achilles tendon pain. An insole in your shoe can make a huge difference. Especially with a metatarsal pad, it will get a ton of pressure off the front of your foot. Your toes won't get as sore. And people think that that's nerve pain from the Charcot Marie Tooth, but it's ball of the foot pressure and pain. If you can get rid of that, your nerves won't hurt as much, you'll be less swollen, and your balance will improve. Number two, they've done studies on ankle braces. If somebody tries to balance on one leg like this, and they're wearing an ankle brace, they can balance 3 to 4 times longer on average than someone without an ankle brace. That's huge for your stability. You're less likely to sprain your ankle. You're less likely to have ankle pain and swelling. That has a feedback on your nerves, where your nerves and your pain feel even better. And that's really the key. It's so simple, but the results are unbelievable for a lot of patients. And for a lot of my favorites, orthotics and braces, I have those linked down below. Pain management. So especially at nighttime, you're gonna have pain in your nerves, in your toes, in your ankles. The number one thing you can do is those orthotics and braces, as I mentioned, but there's phenomenal creams. I always recommend the creams for my patients. I have a lot linked down below. Guess what? They're now cheaper. They're pretty safe. You don't have to ingest them in your pill. Yeah, sure, there are things like aspirin, ibuprofen, acetaminophen, but there are a lot of side effects. Your body has to process them. They're hard on your liver, on your kidneys. I love the creams. I link some cream options down below. The creams usually work a whole lot better for me. Number 5, foot care and proper footwear. So I mentioned the insoles and the braces, but you want a podiatrist to take a look at your calluses, especially at the bottom of the foot. This is all covered. We can clean off the calluses, the hard skin. There are procedures that we can also do to lengthen the tendons that can relieve the hammer toes. And this is not a procedure where you have to get pins in there or screws. This is stuff that you can essentially do without an incision, kind of like a trigger finger release, but you can do hammer toe corrections and clean up those calluses. And then you want to get the proper footwear. So what happens is, if you have a shoe that's rubbing on your toes, on the ball of the foot, you're going to get chronic nerve pain and rubbing there. You want shoes that are soft in the front along the ball of the foot. For older people, I love the orthopedic shoes. Number 1, Ortho Feet. Hey, full disclosure, I do work with Ortho Feet. It's my favorite orthopedic shoe. I dispense them in the clinic as well. So if that's biased, I'm biased, but I love that company. They do a great job for people's shoes and toes. I got those shoes for my parents as well. But other alternatives, I love Brooks. I love Asics. I love Hoka. I love the Brooks Ghost as well. The different types of Hoka shoes. Those are great rocker bottom, high arched feet. Brooks Ghost Max and the Hoka shoes are probably the best running shoe choices with Charcot Marie Tooth. Those are my favorite shoes for a high arched foot type. They have that midsole rocker. They can make a big difference. And also check out Ortho Feet. Those are all linked down below. Those are great shoe options. These days, I think these shoes are so good. You don't have to get custom shoes like you once did. They will help your balance. They will help your pain. They'll reduce the stress on your feet. Number 6, regular exercise. If you don't use it, you lose it. What I always tell for most people is there's 3 things you want to do. You want to walk at least 5,000 to 10,000 steps per day, as much as possible. 10,000 if you can do it. You want to strength train at least 2 to 3 times a week for about 30 minutes. If you do that, you're doing better than 90% of people in society. And then the third thing you want to do, you want to watch your calories. I know it's hard to keep track of your calories, but it's very easy to calculate how much you burn in a day, and make sure you stay under it. Walk your steps and strength train your legs, your upper body. If you do that, you're way better than 90% of people in society, and theoretically, it's so easy to do. The studies are so good for that regular exercise. It will help you so much. Number 7, surgical interventions. I kind of mentioned in the office, we can do plantar fascia procedures. We can do shockwave. We can do lasers. If you have hammer toe contractures like bent toes on your high arched foot type, we can straighten those toes so they're not rubbing in your shoe. These are simple, easy procedures. There are bigger surgeries where you can reconstruct the foot. I wouldn't recommend that, especially with worsening nerve disease. For some people, it would benefit. I personally have gotten away from doing those bigger procedures. Number 8, this doesn't really apply to me, but speech therapy. If Charcot Marie Tooth affects your vocal cords, speech therapy can work really well to help people. And number 9, nutritional support. With Charcot Marie Tooth, you don't want to be overweight. That's extra stress on your body. You want to get as fit as possible, watch your calories, and the big thing is there's a lot of foods and a lot of supplements that can improve nerve healthy vitamins. So specifically your B vitamins, your magnesium, your vitamin D, alpha lipoic acid. There are so many good things you can eat in your diet. I actually have videos on all that. And number 10, having a nerve condition is depressing. You may need psychological support, friends and family to keep you going, but these things can work really well. There is a lot of hope. You have to hold on as much as possible. There's better neuroprotective drugs coming out. There's better genetic screening. There's stem cell therapies being worked on. And there's actual gene injection therapies that potentially could cure Charcot Marie Tooth. So if you're a young person with Charcot Marie Tooth, potentially by the end of your life, this might be cured and you might be completely healthy. So be as optimistic and energetic. If you do these things, I've seen patients have phenomenal improvements. And I know it's not for everybody. I know this is hard. This is not meant to simplify it and make it seem like I'm curing this thing. I say this very humbly. I know I can't cure everybody. This is a hard world for a lot of people, but anything we can do to improve, that's really all we can do. Check out my neuropathy guides. I hope that helps. If I'm missing anything that you can think of, let me know in the comments.